COVID-19 testing plays a major part in how fast states can reopen nationwide. And right here in Nevada, there was a lack of testing, of course. The I-Team's Vanessa Murphy is taking a look at what unfolded here in our state of Nevada and how we are trying now to move forward. Vanessa?
Brian, right now in Nevada, we're testing about 3,000 people a day, and widespread testing is important because it allows health officials to monitor the spread of the virus. And keep in mind, about 80% of positive cases have mild symptoms or no symptoms at all, but they can still spread the virus to the vulnerable.
Oh my goodness, I am angry.
Getting tested for COVID-19 as the virus began to spread in Nevada was a challenge. Many shared Nora Mirabal's struggle. On March 5th, we learned about the state's first diagnosed case. Shortly after, Governor Steve Sisolak announced the CDC committed to providing tests.
We identified needs and we made the calls. I can tell you this, the CDC is listening.
But 5 days later, when the governor declared a state of emergency. What is the status of the tests from the CDC?
We are working with the federal delegation. I've talked to the Vice President's task force. We are frustrated that we are not receiving more tests in a prompt manner.
The next day, we learned the Southern Nevada Public Health Lab was at capacity, and hospitals and doctors were reporting shortages of tubes used for the tests. How frustrating is this that we don't have enough tests here?
I think it certainly hampers our ability to do what we need to do, because we are having a difficult time assessing how many cases we actually have. By
March 16th, the health district could only do 40 tests a day.
We've been promised by FEMA multiple times the delivery of tests.
A few days later, the health district confirmed FEMA would not provide what was expected.
We have not gotten any test kits from the federal government.
Governor Steve Sisolak created a task force to address issues like testing. Private labs like Quest and LabCorp offered tests. Nevada was approved to develop its own testing without approval from the federal government. The number of clinics offering drive-thrus slowly grew. In early April, Governor Sisolak announced the federal government finally sent Nevada a few thousand test kits. UNLV School of Medicine and UMC offered more tests. Later in the month, employers like Wynn announced testing for employees.
Anytime, for free.
By May 1st, Nevada had a reported 5,311 positive cases and 43,595 people tested. Testing was targeted in zip codes hit harder by the virus, and now, in addition to symptomatic patients, asymptomatic Nevadans can be tested too. Governor Sisolak told the I-Team last week while testing is expanded, more is still needed.
Tested so that we're sure that everybody, it doesn't get into wild surge and an explosion of the virus.
The I-Team's George Knapp recently interviewed Jim Murrin, the head of the governor's task force. He says the goal is to be able to test 30,000 people a day. He believes we can reach that goal by June. By the way, we have more information about testing at 8newsnow.com. Reporting live, Vanessa Murphy, 8 News Now.
Vanessa, thank you for that. Here is some of those testing sites that are expanding across the valley. There are 7 Walmart locations that you could get tested at right in the parking lot. You must schedule an appointment before going to the location. Testing times and dates vary for each location. We have those listed as well as a link to make an appointment, all on our website, 8newsnow.com. Denise?